liberation treatment, which has been hailed by some as a treatment for multiple sclerosis. But now it's being discredited by Canadians. University of British Columbia researchers report in The Lancet that a narrowing of veins from the brain is no more common to MS patients than healthy people. But some who have had the treatment still say that they believe it works. One of those people, Dr. Bill Cote, a retired anesthesiologist with MS, who says his treatment was a success. He joins me now from Victoria. What do you think then about the research coming out of BC today?
Well, I think the research coming out of UBC and the University of Saskatchewan is actually a great step forward for the understanding about veins in the neck, and probably also eventually we'll be looking at vein issues within the brain. Because I think that's what Dr. Zamboni's initial articles started to say was it was a different thing how things were happening. Now, what they're saying from the article, of course, is that nearly 65–70% of people, whether they're normals, so-called normals, or people that are siblings of MS patients or MS patients, roughly that number, when you do catheter dye injection studies of the neck veins, have narrowing of their veins. So that's a much higher number than anybody has talked about before.
Let me give our viewers a little bit of perspective. The research has come out, and what they did was they looked at a number of different people, those who suffered from MS, their siblings or relatives who did not suffer, as well as others who were considered healthy and had no trouble at all, and found that basically the narrowing of the veins happened in many of them, as opposed to finding a narrowing of veins just in those suffering with MS. The treatment that we've been talking about, this liberation treatment, looks at expanding the veins as a way of dealing with MS and dealing with the effects of MS. I know you've had the treatment. Can you tell us a little bit about what was done for you, when it was done, and what the result was?
So I had my venous angioplasty of both jugular veins and the azygos vein. Those are the three major veins draining the head as well as the spinal cord, so draining the brain and spinal cord area. So the important thing it did for me was it profoundly made a difference in my brain clarity, or reducing so-called brain fog.
Okay.
Not a term that neurologists like to accept, but it also made a very big difference on fatigue and bladder issues for me.
And how long ago? How long ago did you have the treatment?
And my procedure was in November 2010, so roughly 1 year after CTV actually broke the story in W5. It was roughly 1 year later that I had my procedure done in California.
And do you still feel the benefits of it today?
I do. I still have most of that mental clarity, and I still have most of that, fatigue reduction, and the bladder is still at least half better than it was. Now, the other piece that people often bring into the question is, Dr. Zamboni never said that this is the only cause of MS. And I don't think there's anyone would say that MS isn't just a collection of other factors going awry to culminate or end up in that individual getting multiple sclerosis. But I do believe this is a piece of the puzzle. But the other really important thing to look at when you've got 65 to 70% of people with narrow veins, this narrowing of veins, or this change of venous return from the brain and so-called backup pressure or changes within the brain in blood flow and therefore oxygen flow, very important to an anesthesiologist. This is a very major factor in a lot of brain illnesses potentially. So that literature so far suggests that it's really key in things like migraine headaches, Parkinson's, and traumatic brain injury. So certainly if someone has traumatic brain injury, then this becomes a part of that puzzle. So it'll be really interesting to watch these people over time.
So that being said, if you were counseling someone who had MS, and I know that is not your job, but as a person who suffers, if you were speaking to a friend or speaking to someone you knew who had MS and they were interested in getting the treatment, would you still recommend that they do that?
I would still recommend it, but I would spend an extra few minutes because there's a collection of symptoms which are very much present in those with this narrowed vein phenomena impacting on their well-being. So So that's things like headache, fatigue, bowel, bladder, blood pressure concerns, and mental clarity. So if people with MS do not have those symptoms, and I've seen some of them, they've gone for treatment and they've got no benefit.
All right.
So I think you must look at because there's some overlap of those symptoms with MS symptoms. But if people are clear of all of those symptoms, I call them CCSVI symptoms, then I would not suggest that they go for the
All right,
procedure.
so it's symptom
But
dependent.
as side effect, yeah, I've also sent people with migraine headache that have some of those symptoms. And I've sent people with Parkinson's and traumatic brain injury, because this is bigger than MS. It's great because the study, it confirms that this exists in humans. And so now the genie's out of the bottle. This is now one of the major medical journals on the planet, The Lancet. And so it's a really exciting time for all of us to have a new concept that might make a difference to our brain well-being.
All right, Dr. Belko, retired anesthesiologist, speaking to us from Victoria. Thanks very much. We have to take a short break. Back